The conditions that make for health, the determinants of health are elaborated in such documents as the Declaration of Alma-Ata and the Ottawa Charter. This more recent list, to which I would add access to safe water, is found in the Jakarta Declaration. The provisions of these prerequisites is only to be achieved by collective action, and thus constitute a set of civic obligations. The right to health places the well-being of people, groups, and communities at the center of the health system. The right to health includes active and informed participation in the development of health policy, implementation, and accountability. Effective participation is based on the availability of accurate and fair information. To the extent that this is compromised by the promulgation of half-truths and misrepresentations or fear-mongering, our right to health is also compromised. The right to health is our birthright. Like other human rights, the right to health is not given to us by the government, nor does it have to be earned. We are born with, in the words of Thomas Jefferson, endowed by our Creator with unalienable rights. I think that if our people fully understood the implication of these concepts, we would not have seen the kinds of public displays that occurred last summer in some of the town hall meetings. Everyone has the right to health. The right to health means that governments must generate conditions in which everyone can be as healthy as possible. Everyone is entitled to all the freedoms, all the rights and freedoms set forth in the Universal Declaration of Human Rights, without distinctions such as race, color, sex, language, religion, political or other opinion, national or social origin, property, birth, or any other status. The right to health and the imperative that the nation state respect, protect, and fulfill that right includes everyone. It includes those whom some attempt to marginalize, stigmatize, or oppress on the basis of race, nationality, social class, or sexual preference. It includes those who are invisible due to enslavement, incarceration, or detention. It even includes those who, like migrants attempting illegal border crossing, engage in actions that we might not approve. For those who fully embrace the right to health, concerned action extends to advance the health status of people around the world. They both teach and learn from international colleagues in a spirit of cultural humility and respect. They refrain from raiding other nations of the healthcare professionals that are critical to their struggle to achieve health for their citizens. As we comprehensively understand the right to health, we will be active in protecting the right of those generations who come after us. Our concern in this regard will be demonstrated by attention to such things as environmental rights and the maintenance of an effective public health infrastructure as legacies. The highest attainable standard of health. This is one of my favorite phrases in all of the international human rights documents. Reference to the highest attainable standard recognizes the relative differences in what might be feasible in a poorer nation when compared to those that are more affluent. But this very relativity seriously indicts a nation such as ours that with so much wealth performs so poorly in health outcomes when compared with nations that have fewer resources. This phrase also connotes a sky-high goal for what full realization of the right to health can mean for us both now and in the future. It begs us to imagine what the world might look like if all that we do in the areas of practice innovation, infrastructure development, education, policy formation, and research were optimally actualized. A world where everyone had the chance to experience health through her or his lifetime that was as good as it could possibly be. A dream, perhaps, but certainly one worth our efforts and struggles. Remember, everyone has the human right to the highest attainable standard of health. Tell someone else Guyana. Thank you. Thank you.